Wisconsin's Ron Johnson said this about health care. We've got to start talking about transitioning. Yeah, you can get rid of the law, but what do you do with what's already there? Am I opposed to state-based exchanges? No. It may be that they can be usable. Well, Wisconsin Republican Senator Ron Johnson joins me now to talk about this issue. Senator Johnson, good morning to you.
Good morning, Chuck.
Obviously, you did this interview with the National Review talking about, okay, it's time to have a different conversation about health care. I want to play a little bit. You were a big advocate of repeal for a long period of time.
Still am.
Let me play a little bit of that and then ask you about this National Review comments.
Sure. Exhibit A of large government, out-of-control government, intrusive government is a health care bill. That's why I totally support the repeal of that. Imagine how much uncertainty would be removed and the level of confidence that would return if the entire Obama agenda were repealed tomorrow. Pretty soon, everybody will be forcing the exchanges. We're going to basically have a de facto single-payer system. Hopefully, America will come to its senses, and our votes will be about how do you start dismantling this beast.
I'm sure it's odd to hear yourself in your ear as I'm doing this interview, but what's changed in your mind that you have to have a different conversation about what to do about health care?
Well, it isn't what's changed in my mind. It's, the actual reality situation. Obamacare, or actually I've been getting more disciplined about calling it the the Patient Protection and Affordable Care Act, because it does neither of those things, but it's been implemented now. So now you're going to actually have people on the exchanges. You're going to be, these risk pools are going to be set up, and so you have to deal with the reality situation. This isn't just a piece of paper right now that you can repeal and it just goes away. We should repeal the law. I mean, that's still my goal, but the fact of the matter is we have to start dealing with the reality situation. Obamacare exists. What are we going to do with it? How are we going to limit its damage? And that's really, I think, what Republicans, we have to be responsible to limit the damage to real people's lives. You were talking about the Talk Fest last night. For an hour when I was on the floor, I just read emails that we were getting from real people, from Wisconsinites, people that are scared, that are begging for relief, that are seeing their premiums increase by 100, 200, 300, and 400%. This is real damage being caused to real Americans, and I think it's our responsibility to do whatever we can to limit that damage, to try and repair the real harm that's been done to people.
Well, you talk about that there has been damage. Do you believe that this law has helped some people as well?
If there's been any help to individuals, it's because the American taxpayer, or quite honestly, Chuck, it's our children and grandchildren. A debt burden is being placed on their back to pay for those subsidies. So, President Obama said he's going to bend the cost curve down. He didn't. He dramatically bent the cost curve up, because when you mandate certain coverages, that necessarily increases the price of health care. So anybody who's been advantaged by this thing has been done on the backs of our children and grandchildren, because we can't afford this. So, yeah, I don't doubt that some people are going to be better off because of this, but there are going to be a whole lot more people, millions of people, that are far worse off. And let's face it, all these promises that President Obama made, if you like your health care plan, right, people aren't being able to keep their health care plan. They're losing their doctors, they're losing their treatments, they're losing their prescription drugs, things that have kept them alive. And that is what last night I was pleading with my Democrat colleagues to start working with us to start limiting that damage to the American public.
Now, you said in the National Review interview that you were no longer, or you were not opposed to state-based exchanges. So have you given that advice to Wisconsin Governor Scott Walker?
Well, first of all, that is being mistypified.
Okay.
Certainly the state exchanges they're constituted under Obamacare. I'm totally opposed to those things because they mandate all kinds of coverage. The concept of risk-sharing pools, of these state exchanges exist. Is there some way you can utilize that structure and yet still preserve the freedom and choice of Americans to choose whatever health care coverage they actually want? In other words, allow any kind of plan to be purchased through those state exchanges. I mean, if people want to buy the gold-plated plans, all the mandated coverages through Obamacare, they can, but I doubt very few will, because it's so much more expensive. So again, I'm just talking about the concept of certain types of marketplaces that can help individuals access the free market. But one of the things you'd actually eventually do is allow people to purchase insurance across state lines, equalize the tax treatment so that individuals that are buying it on the individual market get the same tax advantage as individuals that get their insurance through their employers. So listen, the concept, I don't necessarily have a problem with, but the Obamacare state exchanges I am utterly opposed to.
So do you want to see Scott Walker look at something that you're describing, see if he can build a state exchange that encompasses what you want and does it, but also within the law of the new health care law?
I was totally supportive of Governor Walker's decision not to enact a state exchange and not accept the Medicaid expansion because he knew that the federal government can't afford it, and eventually Wisconsin taxpayers are going to have to pay for that. So, no, I totally support Governor Walker's decision not to do a state exchange. I'm just saying, federally, if a state has set up an exchange, if there's some way they can use that for free market reforms, I don't have a problem with that.
I got to ask you, Paul Ryan negotiated budget deal, for or against?
Well, I understand exactly what Paul was trying to do. I don't want to shut down the government. That was pretty much the task he was given. It's not the plan that he would enact by any means. This is really more a Patty Murray budget. And the real problem, and I really don't want to see Republicans divide on this, the real problem we have is President Obama, Democrats in the Senate and the House, they don't want to fix these long-term problems. Republicans do. But until we get a willing partner on the other side that's willing to acknowledge the problem and work with us in good faith to solve it, it's pretty hard to move forward with real reforms, and that's the situation Paul was in, trying to negotiate something, because I don't want to shut down the government. The federal government does enough harm to our economy. We don't need to do shutdowns to increase that harm.
All right, you didn't say whether you were going to vote for it or against it.
I'm looking at it.
You're still looking at it, so you haven't made a decision?
No.
All right, Senator Ron Johnson, Republican from Wisconsin. All you Wisconsin guys, a lot in the news. Walker, Ryan, Johnson, keeping us busy here. Thank you, sir.
Have a good day.